Good morning, everyone. It's Dr. Cardona. I wanted to talk to you today about EOBs. You know, that piece of mail you get after you visit the doctor's office a few days later. That is very confusing. You get it from the insurance company and explains, or it tries to explain, all of the charges that the doctor made to the insurance company. And it scares you because it says in really big letters at the top that this is not a bill, but it's a lot of dollar amounts that scare you because they're pretty high. And then eventually you will get a bill from the clinic, and none of it makes sense. And recently I took my oldest son, to the ENT doctor for a routine follow-up. He goes once a year for a hearing test with the audiologist, and then also sees the ENT doctor. And he had his annual visit about a week ago. And then of course we got the EOB in the mail. And of course, again, I was confused by the EOB, so I had to go through it and translate it. So I thought this was a good opportunity to go through it with my patients. So let's do it. Okay, so here's the EOB. This is what it looks like, and I'm sure everyone has seen one of these before. And again, if you have, it's super confusing and very scary because there are lots of dollar amounts on this. Even though it says this is not a bill, it freaks everybody out because the one thing you immediately go to is amount you owe, even though it says this is not a bill. And so this is a piece of mail that comes from your insurance company. So let's go through it really quickly. What you'll see here for this one in particular, it's for my son Anthony. And what happened for his visit is that he had essentially two visits wrapped into one. He saw the ENT doctor, which is this charge here, and then he saw the audiologist for his hearing test, which is this charge here. What I immediately saw was actually that he had 3 hearing test charges. There's this one on the front page, and then I flipped on the back and there are 2 more hearing test charges. And what I noticed is that there is nothing to distinguish this hearing test from this hearing test from this hearing test. And I thought immediately, well, was that a mistake? Did he get charged 3 times by mistake? But each charge was a different dollar amount. And it took me forever to try and figure out why were there 3 separate hearing test charges, because he only had 1 hearing test. And if you've ever had a hearing test before, my son went into the big hearing test booth, the big soundproof booth, and then the audiologist was on the other side of the booth, and that was it. It was a pretty standard hearing test. But what I figured out was that this was the charge for the hearing test booth, or the booth. I think one of these charges was for the audiologist looking in his ears, the otoscopic exam. And then one of these charges was for the tympanometry, where she took a machine and basically used it to find out if there was fluid in his ears. And so each component got a charge, and I think that's why he had 3 separate charges. So the EOB itself, lots of columns, pretty self-explanatory. This first one is the date of the visit, and then what was charged, which was the office visit or the outpatient visit. This first column is what the clinic, also known as the provider, so this was a Nemours Children's Clinic visit, what they charged the insurance company, $284. I'm going to skip this column for a second. The allowed amount is different than the actual visit charge. The allowed amount is what Blue Cross is allowing Nemours to charge that visit. It's the most that the provider is allowed to charge for one office visit. It's the contracted amount. So this is going to be different for every clinic and every insurance company. It's what Blue Cross and Blue Shield of Minnesota has contracted with Nemours Children's Clinic, ENT, for every office visit that cost is $213.38. So Nemours Children's Clinic ENT has to write off $70.62 of that visit. And that's what this code means. So even though they charge $284, they're only allowed to maximally charge $213.38. The amount, the non-covered amount is what is not covered under your specific insurance plan, which for this visit was $0. If you have a secondary insurance, this is where that amount would be placed. So for example, if you have a spouse who has also insurance coverage, and that insurance coverage would pick up some of the cost of this ENT visit, that amount would be here. That's where a secondary insurance would be helpful. Deductible amount. This is where the definition deductible, you'll see deductible is the amount that the patient is responsible for before your insurance plan starts paying for your healthcare costs. So you'll see that the amount equals the amount of the visit, the total of the visit, the charge of the visit, basically. And so that will be applied to the deductible. I don't have a copay. Our insurance plan doesn't charge a copay for visits, so that's why this is $0, but it will be different for different insurance plans. Coinsurance is different than copay. Coinsurance applies once your deductible is met. So once your deductible is met, your insurance plan will start covering the cost of your health care. But most times, for most plans, it does not cover the cost of your health care 100%. You will still, the member will still be responsible for a portion of that health care, and that's what your coinsurance is. For us, we have a 20% coinsurance. So once we hit our deductible, we are still responsible for 20% of whatever our healthcare cost is. Our insurance will only cover 80% of it. This is what we have paid of this amount so far, which is $0. And then this is what we owe. So this is what I expect to be billed by Nemours in a few weeks. Okay, so that's how that is explained. The same thing applies for the hearing test. $195 was billed to insurance for the hearing test, but Blue Cross only allows Nemours to charge $105.05, so they had to write off $89.95. $105.05 will be applied to my deductible. I did not have a copay. Coinsurance doesn't apply right now. I haven't paid any of that yet, and so I still owe that $105.05. Same thing for this charge, same thing for this charge. So over here, everything that I owe will be totaled up. So down here in the benefit summary, this is the total of both the ENT visit plus the hearing test is $432.72. So this is the total of what I owe and what I expect to get a bill for from Nemours in a few weeks. That total amount will be applied to our family deductible for the year. This is our year. So our insurance coverage runs from the 1st of July to the 31st of December, and we have that entire year to meet our deductible, which is $3,800. Once we meet $3,800, then our insurance plan will start covering cost of our health care. However, we still have a coinsurance, like I said before. So coinsurance for us is 20%. We will still be responsible for 20% of everything that we everything that is healthcare related. They will pick up 80% of it, but we are still responsible for 20% of it out of pocket. Now, you'll see down here that we do have an out-of-pocket limit. So with deductible out-of-pocket cost plus coinsurance out-of-pocket cost, once we hit $9,000 out-of-pocket for this year, then the insurance company will cover everything 100%. I'm fairly confident we're not going to hit $3,800, and I'm pretty confident we're not going to hit $9,000 out of pocket. That's essentially the explanation of your EOB. Now, let's do a hypothetical EOB for a patient who is a member of a direct primary care practice. Let's say a patient comes in for a routine visit and wants to talk about hypertension, and while he is here says, "Oh, by the way, Dr. Cardona, can you remove a wart for me?" And I say, "Sure." And he says, "Oh, and also I have a scratchy throat and my son was diagnosed with strep yesterday. Can you look at my throat and see if I have strep throat?" And I say, "Sure, why not?" So let's do an EOB for a patient who comes in to follow up for hypertension and also wants to have a wart removed and also wants to have a strep test. And let's see what that EOB would look like. Okay, so here is my pretend EOB for a Cardona direct primary care patient. Okay, claim number. What's that? Patient IDA, don't need. Patient control number, don't know what that is. Group number, have no idea. Group name, don't know. Provider, Dr. Cardona. Great. Okay, let's see. Date of service. Let's say it was the 20th of July. And he came in for an office visit and a wart removal and a rapid strep. Okay, and let's just say he is a member, a direct primary care member, and he pays $99 per month, which is what I charge. So for this visit on the 20th, what would that look like? What would I charge? Well, he gets charged his $99 per month. Okay? That covers everything. Provider responsibility amount doesn't apply. Allowed amount doesn't apply. What's not covered? What's not covered? Covered, covered, covered. Everything's covered, so it doesn't apply. Amount paid by another insurance. I don't charge insurance, but it doesn't matter because everything's covered, so it doesn't apply. Nothing's applied towards your deductible because I don't charge insurance. What does the patient pay me? Is there a copay? 0, 0, 0. There is no copay. Coinsurance? There is no coinsurance. What does the patient owe? 0, 0, 0. Because everything's covered under his $99 per month. So for this visit on the 20th, for an office visit, a wart removal, rapid strep. Everything's pretty simple. Nothing's owed, there is no copay, there is one charge, his membership fee. Total, 0. Direct primary care.